As men age, there are many changes the body goes through that can be surprising, frustrating, or even worrying. But there's one part of the male body that often gets overlooked until problems start to appear: the prostate. Once a man hits 60, keeping an eye on prostate health becomes not just important, but essential. The prostate is a small gland, roughly the size of a walnut, located just below the bladder and in front of the rectum. It is part of the male reproductive system and plays a key role in producing seminal fluid. For most of a man's life, the prostate goes unnoticed. It quietly does its job with no signs of trouble. But past the age of 60, things can start to change. Unfortunately, many men do not know what to look for until a small issue becomes a big one. This is why learning the signs and symptoms of prostate problems early can make a huge difference. Catching an issue early means more treatment options, better outcomes, and less stress down the line. One of the most common prostate issues in older men is benign prostatic hyperplasia, or BPH. That is a medical term for an enlarged prostate that is not cancerous. It happens as a normal part of aging, and by age 60, more than half of men will have some signs of BPH. The most noticeable symptoms come from how the enlarged prostate presses against the urethra, the tube that carries urine from the bladder out of the body. This pressure can cause a whole range of urinary problems. You might notice a weaker stream when you urinate or feel like you cannot completely empty your bladder. Some men experience frequent urination, especially at night. You might find yourself waking up several times just to go to the bathroom. Others feel a sudden, urgent need to pee, even when the bladder is not full. These symptoms can sneak up slowly, and many men brush them off as just part of getting older. But that is a mistake. These signs could mean BPH, but they could also point to a more serious problem, such as prostate cancer. Prostate cancer is one of the most common cancers in men, especially those over 60. In its early stages, it often has no symptoms at all. That is why regular screenings are so important. But when symptoms do appear, they can overlap with the signs of BPH, which makes them easy to miss. Some warning signs of prostate cancer include difficulty starting urination, painful urination, or blood in the urine or semen. You may also notice pain in the lower back, hips, or thighs, areas close to the prostate. In more advanced stages, prostate cancer can lead to weight loss, fatigue, or even erectile dysfunction. It is important to understand that just because you have these symptoms does not mean you have cancer. They could also be caused by infections, inflammation, or other conditions. That is why a proper evaluation by a healthcare provider is necessary. Do not self-diagnose, and definitely do not ignore the signs. Prostatitis is another condition men over 60 should be aware of. Unlike BPH or cancer, prostatitis is often caused by an infection. It can lead to sudden, severe symptoms like fever, chills, pelvic pain, and painful urination. Chronic prostatitis can cause ongoing discomfort, pain during ejaculation, and a constant feeling of needing to urinate. If you experience any of these, especially if they come on suddenly, it is time to see a doctor. Now let us talk about something a bit more uncomfortable but very real: urinary incontinence. While not always directly caused by prostate issues, an unhealthy prostate can contribute to it. If the prostate puts pressure on the bladder or urethra, it can lead to leaks, urgency, or dribbling after urination. This can be embarrassing, but it is also a sign that something is not working quite right. Sexual health can also be affected by prostate problems. If you have noticed changes in your erections, decreased libido, or pain during ejaculation, do not ignore it. While aging does bring natural changes to sexual function, a sudden shift or new discomfort could be tied to prostate trouble. So, what can men do after 60 to protect their prostate health? First and foremost, regular checkups matter. Even if you feel fine, an annual exam that includes a digital rectal exam, where the doctor feels the prostate through the rectum, can detect abnormalities early. This may sound unpleasant, but it is quick, and it could save your life. There is also the PSA blood test, which measures levels of prostate-specific antigen. High levels of PSA might indicate inflammation, BPH, or cancer. However, the test is not perfect, and high numbers do not always mean something is wrong. That is why your doctor will consider all the factors, your age, symptoms, and family history, before making any recommendations. Speaking of family history, if your father or brother had prostate cancer, your risk is higher. Make sure to mention this during your checkups. You might need to begin screening earlier or more frequently than others. Lifestyle choices also play a big role in prostate health. A diet rich in fruits, vegetables, and healthy fats supports overall wellness, including your prostate. Foods like tomatoes, which are high in lycopene, and green tea, which is full of antioxidants, may offer additional benefits. Staying active, maintaining a healthy weight, and limiting alcohol can also help reduce your risk of prostate problems. Stress is another factor that tends to go unnoticed. Chronic stress can impact hormone levels, which in turn affects the prostate. Make time to relax, get enough sleep, and find healthy ways to cope with stress. Your mental health and physical health are more connected than you might think. If you're experiencing any of the symptoms mentioned earlier, changes in urination, pain, sexual dysfunction, or unexplained weight loss, do not wait. Make an appointment. It is not about being paranoid. It is about being proactive. Prostate conditions are highly treatable, especially when caught early. Medical advances have improved both diagnosis and treatment options. Whether it is medication for BPH, antibiotics for prostatitis, or a range of treatments for prostate cancer, there are solutions. But you will not benefit from any of them if you do not speak up. Some men avoid these conversations because they are uncomfortable. Others feel embarrassed or fear bad news. But ignoring a problem will not make it go away. In fact, it could make it worse. Take charge of your health and make prostate care part of your regular routine. If you are over 60, remember that staying informed is one of the best things you can do. Talk to your doctor. Learn your risks. Understand the signs. And most importantly, take action when something does not feel right. Because when it comes to your health, silence is not strength. It is a risk. Early detection can be the difference between a small problem and a life-changing one. So listen to your body, ask questions, and prioritize your prostate health. There is nothing weak about taking care of yourself. In fact, it is one of the strongest things you can do.